back to my job every day is we see there's a lot of pain, there's a lot of patients' expectations, and there's a lot of illness. The burden of disease is pretty high, and that is where the healthcare can do phenomenal work. Reaching out to the society, reaching out to the people, taking care of their distress, taking care of them emotionally, psychologically, doing curative and rehabilitative work is extremely important. And it is also, since the mission and vision of our institute is to provide compassionate care along with education and research. So it's very comprehensive delivery of healthcare, and that is what is lacking in our country and some part of this continent. So that is a very fulfilling exercise that allows me to keep coming back each day to work and look at all the processes, how we could make it more cost effective, how we could make it more lean, how we could add value, how we could initiate quality improvement exercises. And ultimately, it all comes back to the patient and the carer who has huge expectation from us. So we feel that it is a responsibility, more so because the founder of our institution, she is a divine figure, and then she basically nurtures that we need to love all humanity at large and need to reach out to all these people. And what best forum or platform could be there as our institute or healthcare to be able to diminish their pain, to be able to alleviate their distress and also work with them. Healthcare associated infection is, I feel it's always been a dual journey. Some portion of the healthcare professional feels that it's been there, seen that syndrome, and the other group of people feel that there is too much to ask and there is too much of resources which is required. There is a lot of change which has happened in healthcare associated. It was infection earlier, then it became nosocomial, then it became hospital acquired, now it's healthcare associated. You and I basically are responsible for the goofing up or messing up which we do, for which the patient unfortunately has to pay. What I have seen through my visits during accreditation and assessments of many of the hospital, public and private sector, there is a lot of good work which is happening in hospital infection control. So there's chapter 5 where people know about the definition, people are working towards making the policies, people are working towards understanding the surveillance. But there is much more which needs to be done because unfortunately our country is very diverse. Most of the good hospitals, so there would be at least 800 plus hospitals which are accredited as a large institution, and but the total hospitals which are there in the country would be close to 70,000 plus. So it is just a drop in an ocean. What needs to be done is something which is of a large magnitude. But the good point is that infection control work is happening. There is a lot of movement. There is a lot of work on. Fortunately and unfortunately, because of COVID, there is an attention which comes during this unprecedented time. But a lot needs to be done. Be it planning and designing, be it diagnostics, be it good practices, be it just the hand hygiene, disinfection, medical, surgical asepsis. There's huge work, and how we can sort of collaborate, integrate, and bring in technology and make it more real-time and simplistic. So many good institutions, though unfortunately islands of excellence, but good work is happening. I think we need to handhold other institutions and take them along with us. And I'm sure we would have some kind of an infection-free society at some point of time. to be looked at a very, very big 35,000 feet picture. Uh, Infection prevention needs to be linked with antimicrobial resistance. Many a times when we speak to the clinicians, they pump in antibiotics because they are not very sure about the infection control practices within OR and ICU. So it's generally not a monotherapy but a polytherapy. Plus, there is SOPs which are there in many institutions. But what we need to also understand is the surveillance and the data collection, the power of the data, and presenting it appropriately, looking at the economics of the data. So we need to analyze this data. For that, the definitions of each healthcare associated infection, which is a CDC and HSN definition, needs to be understood. For that, the numerators and the denominators needs to be understood. There needs to be a complete understanding of internal audit process so that we know the nursing staff, the technicians, the clinicians are basically adhering to most of the processes and the definition. We need to also make appropriate, not cut, copy, paste policies, but policies by each institution, just like we make antibiograms for antibiotic stewardship. So similar standard operating protocols needs to be made by the same group of people, whether they are infection control officers, nurses, infection control team, or infection control committee. So it would be extremely good to put some structure in place, which is man, money, material, put in many processes in place, which would be clinical, non-clinical, support service, laundry, linen, mortuary, food and beverages, every aspect of the institution or healthcare service delivery. And it would be also very appropriate to look at outcomes and then plan your corrective actions and preventive actions within the data what you are collecting. Within this, it is very, very essential to look at economics of infection control delivery. Once we make it as a cost benefit, cost effective, cost utility, and cost minimized infection prevention, good practices at each bedside, there is where we are going to make change. So my advice to the peer would be that we understand that in your institution you are doing magnificent work, you are doing fabulous work, you are fantastic, and you are top of the world. It's not going to help. You need to go out and handhold at least 10 institutions in your neighborhood. And that is where the care of infection control and healthcare delivery is going to improve. We were trying to do antibiotic stewardship in our institution. Nothing was changing because the antibiotics were already pumped in the society from primary and secondary care, and they were coming to the hospital. That is where we reached out to the government and said that can we scale it up. And we took almost 6 to 7 years in the state of Kerala to get an infection control policy. We got on clinical guidelines for good prescription practices of antibiotics. We got an AMR containment program, and the whole program got scaled up. And then we reached out to animal health and environment health. We changed the curriculum. So what is required is we need to handhold other institutions which may not have the resources, may not have the training, and see that they also improved along with us. And together, I think we can make a huge, huge difference, and that would be the benefit and for giving back to the society. Every bit of industry needs to work with the institute. So there needs to be an industry-institute relationship. There needs to be a complete understanding and comprehensive structure which comes in place so that we can work together. Unfortunately, there is an idea that we need to only invest on training. But what we are also realizing is that training is not working. We need to change behavior. Behavioral change is not very simple. So if industry is working with an institute, it is just not on training. It needs to be on a more longitudinal manner, where basically you do train, you do an induction training, you do an in-service training, but also look at how do we need to work on ethnography and change behavior so that the practices by each technician, by each nursing staff, by each clinician changes, and then you create a culture. It is also extremely important that the industry brings in technology, which is not always brought in from West. So there needs to be a customization, there needs to be an indigenization, because the requirement of each country, each state, each institute could be different. And we have seen umpteen of examples. So it would be important to customize and to integrate and be open to this innovative idea. There is also, it is extremely essential that all the industry partners realize that investing and working in research and development is critical, especially in India, because cost definitely is a factor. It's one of those decision makers. But then there is a lot of newer ways that we need to deliver care, and it always alcohol hand rubs could be one example, and alcohol hand rubs 60 to 70% of profile and chlorhexidine 0.5% could be another example. So what worked best? So are we only adopting what has been recommended by us from various European and American guidelines, or is there anything else which works best? A good example is Operation Theatre. We are always told about there needs to be an HEPA filter, there needs to be a 3 filter units, there needs to be an air change, positive pressure. Is that what is extremely necessary, or can we work something differently in an indigenous platform which is more cost effective and more beneficial for the institution? So I think industry should be open to bring in technology, to customize, to innovate, to do research, to invest in research and development, to also look at how best we can improve or look at any of the quality initiatives. But institute should also partner with them, because if they are only seen as an outside party, an external party, or as a vendor, it is not going to be a very fruitful relationship. So an industry-institute relationship bringing in a comprehensive change in a healthcare arena would be very, very good and essential. Also, there needs to be investment in creating mentors and young leaders. So if we could all bring in sort of an educational brand where you bring in some good practices, you bring in some awards, you bring in some create a mentoring program, you bring in some ambassadorship program that will also inspire people, encourage people, empower people to follow an infection prevention platform or services and look at a bigger game. So industry should also just not look at infection prevention. They should look at preventing antimicrobial resistance, part of infection control, and that's the bigger picture, which would be very, very beneficial. And we are very open. I'm sure the industry is open, and I think together we can make a huge difference. Let's work together towards good infection-free and good practices